Today, we are diving deep into the official, evidence-based guidelines for giving birth. Now, I know what you're thinking. Guidelines sounds kind of rigid, right? But stick with me, because this is actually all about putting you in the driver's seat. This isn't a rule book, it's a guide to help you really understand your options. This quote, right here, this is the heart of everything we're about to talk about. It comes from the UK's National Institute for Health and Care Excellence, or NICE, and it sets up one single powerful idea. Your voice and your choices are what matter most. They're at the very center of your care. So that brings us to the big question, right? If we strip it all back and just look at the evidence, what choices do you actually have? What are the pros and cons of each? Okay, let's get into it. First up, one of the biggest decisions you'll think about is where you want to give birth. You've got a few main options: at home, in a midwifery unit, or in a hospital's obstetric unit. And as you're about to see, this first choice can really shape your entire experience. But before we even glance at the data, the guidelines make one thing absolutely crystal clear. If you have a low-risk pregnancy, and most people do, giving birth is very safe for both you and your baby, no matter which setting you choose. So let's start from that really reassuring place. Now, to really make sense of the stats, there are two words we need to get familiar with: nulliparous, which is for someone giving birth for the very first time, and multiparous, for someone who's giving birth before. The guidelines separate them out because, as we're about to see, the outcomes can look pretty different for each group. Okay, so let's start with multiparous people, those on their second baby or more. The data here is fascinating. Look at that column on the far right. You can see the rate of serious outcomes for the baby is really low and basically identical no matter where you plan to give birth. But now look at that first column. Your chance of having a spontaneous vaginal birth, without interventions like forceps or a C-section, is actually highest at home and in midwifery units. So what does that tell us? It suggests fewer interventions with no extra risk to the baby. Okay, now let's switch gears and look at the data for first-time mothers. Here, the picture is a little bit different. For one thing, look at those transfer rates. Almost half of first-time moms who plan a home birth end up transferring to a hospital. And then, if you look at that far-right column again, you'll see a small but statistically important difference in outcomes for the baby. So let's zoom in on that. For a planned home birth for a first-timer, the rate of serious outcomes for the baby is 9 out of 1,000. In other settings, it's 5 out of 1,000. That's a difference of 4 in 1,000. Now, that is a small number, absolutely, but this is exactly the kind of specific, evidence-based detail that the guidelines provide to help you make a truly informed choice that feels right for you. Okay, let's move on from where to give birth to what happens during birth. Once labor starts, one of the biggest topics on everyone's mind is, how to handle the intensity and the pain. And the guidelines lay out a whole bunch of options, from non-medical stuff all the way to medical pain relief. So first up, let's talk about the non-medical strategies. These are all about working with your body. The guidelines point to things like breathing techniques, massage, and especially getting in a bath or a birthing pool. TENS machines, which use these little electrical pulses, are also on the list, though that's usually something you'd get for yourself. And then, of course, you have your medical options. This includes things like Entonox, you probably know it as gas and air, and opioid injections. There's even a lesser-known option of sterile water injections that can work wonders for back labor. But the most effective form of pain relief, by far, is what we all know as the epidural. And the epidural is a perfect example of a trade-off. Let's look at the evidence. On the plus side, it's way more effective than opioids for pain, and this is a big one. The data shows it doesn't increase your odds of needing a C-section. But on the other side, you can only get one in a hospital obstetric unit, it's linked to a longer pushing stage, and it does increase the chance that you might need a bit of help from forceps or ventouse to deliver your baby. All right, let's move into the final phase. The baby is born, and it's this incredible, overwhelming moment. But you're not quite done. There are still a couple of really important choices to think about for what happens right after. So this next set of choices is all about what doctors call the third stage of labor. That sounds super technical, but it's really simple. It's just the period of time after the baby is born, but before the placenta comes out. And here you basically have two different approaches. Active management is a whole package deal. You get an injection to help your uterus clamp down, the cord is clamped pretty quickly, and your midwife helps deliver the placenta. The other option is physiological management, which is more hands-off. No routine injection, they wait for the cord to stop pulsing before clamping, and the placenta is delivered just by your own body's effort.
So why are there two completely different options? Why does this choice matter so much? Well, it really all comes down to the effect each approach has on one very specific risk.
And this is where the evidence is just so clear. With active management, the risk of having a heavy bleed of over 500 milliliters is about 6.8%. With the more hands-off physiological management, that risk jumps to 18.8%. So the data is really telling us that active management seriously reduces this specific risk.
Okay, we have covered a ton of ground. We've talked about place of birth, pain relief, what happens right after. So what's the big picture? What is the main thing you should walk away with after hearing all this?
Well, the guidelines really lay out a simple four-step path. First, understand the evidence, which is what we've been doing. Second, think about what's actually important to you. Third, and this is the crucial part, you take that information and have a real conversation with your midwife or doctor. And fourth, remember that nothing is set in stone. You can always change your mind.
And that brings us right back to where we started, doesn't it? The entire point of all this research, all this data, is to give you a toolkit for a conversation. It's not a script you have to follow. It is absolutely not a prescription. It's about giving you the power to be a true partner in your own care. So we'll leave you with this to think about. Now that you're armed with all this knowledge, what's the one question you're going to ask your care provider that will help you start to shape the birth story that feels completely right for you?